All right, congratulations. It's 3 weeks after surgery. You're 3 weeks out. And, well, we've got some more information you. I'm Dr. Ortiz.
I'm Dr. Arturo Martinez.
All right, so let's start off with the first and most important information given by Dr. Martinez.
Well, now, first of all, at 3 weeks out, I know that some people will still have concerns about complications and the possibility of developing any issues with the procedure. If you've been fine with your recovery at this point, I think this is something that you can set aside. You still have to be focused on paying attention to what happens with your body, because if you have any issues, normally the main one that we always focus on is on the tolerance to your fluids. You should always communicate that immediately to us. We can either give you strategies, or we can tell you if it's something that's expected or not expected at this point.
So in the first video we sent you, we told you about the activity level. By this time you should be completely active. We also told you about the oral intake, like we were just mentioning right now. If your oral intake is not up to par, go ahead and let us know. Sometimes minor things like what you're drinking, if you have additional medications to take, might irritate, swell the inner lining of that stomach and might cause intolerance to certain liquids, and of course not keep you well hydrated and with a good intake, protein intake, carbohydrate intake, etc. And lastly, these new symptoms that are going to happen. Most of the symptoms you're going to feel are new, but they should be discussed. So if you have any questions, go ahead and let us know. The number's right there. Again, I mean, it's always available. We gave you a little ID card that you carry with you, and we're always available to you 24/7. Something else?
Yeah, well, among the common complaints that we get at this stage, constipation is still a major one. Remember that at this point you can also add some type of liquid fiber to your diet, and this will definitely help. Some people experience an opposite symptoms, such as diarrhea, which can also happen when you switch the type of liquids that you're having. For example, if you are having a protein shake and all of a sudden you change brands, you add more protein to your drink, or the consistency of the drink is a little bit higher, this can also give out some type of diarrhea. Osmotic diarrhea is also not uncommon. This you would know immediately because it will happen immediately after taking that sip of protein shake. So the strategies here is water down your protein shake, go a little bit slower, and if you need to switch brands, always talk to our nutritionists because they can give you the best advice as to what to have and what not to have. So if you're seeing that after you take a drink, you feel all of a sudden with pressure, you feel a little bit queasy, in some cases even your heart racing or palpitations, this is usually the result of increased pressure. So what you can do to diminish this is just go slow with the fluids, and this will definitely help.
All right, so let me add to that. If we're already talking what's going out, sometimes depending on the procedure you had, you might have bloody stools, either tar-like, very dark stools, or sometimes even fresh blood. Now, that's never normal unless you've had surgery, but again, we want to know. So as long as it's diminishing or disappearing, but when this episode happens, two things have to happen. You have to seek medical attention immediately if it's larger than a small little coloring, and number two, let us know. Sometimes it's just very regular and it can happen with any procedure. And any of the other important signs, which are these emergency signs, you already know them. Discomfort, more than discomfort, actual pain, bloating, incapacity to eat or to go to the bathroom, high fevers, difficulty breathing. All these things are alarm signs that immediately require attention. Don't wait to talk to us, immediately go get medical attention. These things are rare, but we want to tell you because it's important that you know that you're being followed up and that we're here to help you. I don't know if you want to add something else.
Well, the only last thing is that most of our patients at this point are only taking one medication, which is an antacid. It's the main medication you should be on for at least a couple of months after your surgery, unless you are indicated otherwise. And the reason for this is that Dr. Ortiz was mentioning that the stomach mucosa can be a little bit swollen. It's still at this stage, and we want to protect it. We want to make sure that the juices, the acid that's produced by the stomach doesn't cause an ulcer or excessive irritation. So please, even if you feel wonderful, do not stop taking your medication until you finish with the prescription that we gave to you.
And lastly, remember, you might be on medications. If you're taking certain medications, The most important thing is that these might change dramatically with the weight loss. Whatever procedure you had, it's extremely important that you look at your local practitioner, you have a visit with them. They might need to adjust or even remove certain medications. Hypertension, diabetes, high cholesterol, and other medications that are usually routine might not be needed anymore. So we'll come back to you again with the next video or your follow-up video. Congratulations, stay safe, and keep on losing weight.